I'm Joseph Henske. I'm a clinical endocrinologist and the program director for diabetes at the University of Arkansas for Medical Sciences and associate professor of medicine.
Hello, I'm Eric Roth. I'm a writer. I was diagnosed with type 2 diabetes some 20 odd years ago and have been a patient of a Dr. Ann Peters at USC Keck for all these years and have worn and used monitors ever since they became part of the health benefit for it. Anything anybody wants to know about diabetes that I know, I'm glad to share.
Eric, it's great to meet you. I want to know a lot more about your experience wearing continuous glucose monitoring and having diabetes and kind of just your stories of your journey with diabetes and maybe some things about how continuous glucose monitoring has changed your perspective and your insight with things.
Okay.
I guess I would start with when were you first diagnosed with diabetes? You said about 20 years ago?
About 20 years ago, yeah, my primary care doctor discovered it with a blood test, and I have, being an Ashkenazi Jew, it made me prone to having this. I don't know if my mother may have had it. I don't know. I think probably so, only because, and is more of a obvious kind of thing, but she'd have candy out every night while we watched television. So,
And when you were first diagnosed, it was assumed that you have type 2 diabetes or type 1?
yeah, type two. Yeah, yeah.
Okay.
I was not hugely overweight, but overweight, and I had bad habits. I drank a lot of Coca-Cola, um, and I didn't really watch my eating that way for carbohydrates or any of that kind of stuff. So
And,
a
and
lot of sugar. I had obviously we call it a sweet tooth.
and did you start out checking your blood sugars on your fingers?
Yeah, yeah. That's what when I got to Dr. Peters, she had me doing monitoring it that way. Yeah, yeah.
And how often were you checking at that point?
Uh, my memory serves me probably like 4 times a day. Would that be
Oh,
about right? Yeah,
pretty
I think
frequently.
maybe less, but no. Or you think more? I don't remember really. I think it seemed like pretty much consistent with meals.
Sure.
So three, with three and a snack or something.
And you
Um,
and you started out taking pills.
right away, glucophage. Metformin, obviously. That was it, I think. I don't know what else we had back then. You'd have to tell me. I mean, I took whatever she wanted me to take. I think I was a pretty good patient. I'm not great,
Yeah,
but pretty good. And I remember it really scared me.
yeah.
Um, and I remember happened to be a movie writer, and I was at a screening of a movie that I'd written, and this was like that following week that I had been diagnosed, and I was sort of freaked out, and all of a sudden I was thinking I was going to faint and all this. I mean, nothing had changed, from whatever, but it became all of a sudden a new look at life, that I wasn't quite prepared for. And I had been health wise, I had had cancer a couple times, so I mean, I was and others some serious things, and this one really kind of got me. I felt kind of helpless, and she had a diabetes educator there I thought was quite helpful. And then I think she's one of the great doctors, and she, she assured me if I did some of the right things, I could manage it.
And when did you start having conversations about continuous glucose monitors?
That would seem far more recent, but you would have to tell me because I'm sure she gave me that experience as early as possible because she was very conversational and part of kind of beginning glucose monitors. She was a very cutting edge doctor and still is, obviously. So whenever it was the first type that arrived, this was I assume was before cell phones, or is that possible? I don't know.
Sure. Did you
Yeah,
wear it as a kind of a sample initially, or did
yeah.
you
I think I probably had a sample originally. Yeah, yeah. Um,
and then you transitioned to wearing it full time?
no, I never had it full time. It would be more. you know, irregular than that, but based on whatever she felt was when it was necessary for me to start really watching, you know, what I was eating, how it was affecting me.
When
Um,
she came to you with this idea of wearing the monitor, did you were you nervous about it? Had you heard about it before from other people?
I think I was only nervous. I don't, I was wondering if it was going to really sort of make me either conscious or unconsciously aware of it. I don't like wearing things particularly. I do wear a hat occasionally, but and then I was worried how it was going to affect my sleep, whether I was going to be aware of it when I was sleeping, and neither really were true. Neither really were true. No, I like scientific stuff, so it didn't bother me to try to, you know, be part of that and be aware of what was showing about my body. I had no problem with that.
So, so how often have you, how many times have you tried this, or how often have
I
you?
think with almost, I don't know how quickly they change generations of the
Uh,
monitors, but she always tests me with the newest generation, you know.
sure.
So, like most recently, I guess I'm using when I last had one on was a Libre 3, I guess.
Uh-huh.
And, you know, it's pretty spectacular when you can see the results right away on the cell phone, or even worse or better is when the alarm goes off, you know.
Yeah.
I'm all too aware of it when the thing starts shrieking. I was in another movie situation, watching a movie, and it was kind of a science fictiony movie, and the sound of the beep somehow kept in sync with the my alarm going off. I thought was part of the soundtrack, you know.
That's funny. Well, so when you first started looking at your information with her, did you go over kind of like a report, or how did you guys work?
At first, she would. Well, I think she would. She'd show me also my A1C, you know, and then she'd show me how this was affecting it. So I think at one point I was like 7, 8 when I started, maybe even. I probably I started way higher. I might even start at like 12. You know what I'm saying? Because I was so out of control. Anyway, and this helped. Eventually, the monitors helped me get down till I was like 7, 8, and then, I mean, most of the last number of years I've been like 7.3, and that
Wow.
I can attribute a lot of it, I think, to the monitor keeping me aware of, you know. I mean, I always felt like, for instance, I needed a dessert after every meal, so like
Right.
even like a cookie after breakfast, that kind of thing, you know.
Uh-huh.
And so that would say, you know, start shrieking at me, you know,
Yeah.
even if
Exercise.
I eat fairly balanced. I mean, I'm aware of protein and carbohydrate and all that. So my breakfasts were always, you know, I'd always have protein on hand, for instance, and then I'd always screw it up with the this kind of little treat for myself. I mean, I think part of it, interestingly, is that this is not recommending this in any way, shape, or form, but I used to smoke like crazy.
Oh, okay.
I'm a writer, so that it was always sort of part of my ritual. And I mean, I haven't smoked in a long, long time, but that was always sort of my after breakfast thing, you know, eat for a long time, probably more than having some kind of snack, in quotes.
Sure.
But then when that went away, I think that made me more interested in having something to nibble on,
I see.
and not always healthy things.
Yeah. And so you've used this. So do you feel like what you've learned from wearing this um, has helped you make the right choices then essentially in terms of what you eat and when you eat?
Yeah, 100%. Yeah, I mean, because I mean, even though I think unless you just don't think about it, that I think most people are aware what they're eating and not eating. I think maybe I'm wrong. Maybe that's not true, but uh, I kind of knew when I was not doing well and when I was doing well, and then it's get down to, you know, cheating, you know, in a way. I mean, like my doctor Peters always says it. What you don't want to do is go into the glove compartment of a diabetic's car that there's always loaded with candy or something. You know what I'm
Yeah.
saying? So that they figure I can get away with it while I'm driving or something, I guess. Or I
But it
feel.
sounds like the alarms that you were getting had an impact on you. You know, you said that you
No
had,
question about it. Still do. Yeah. I mean, then I feel like kind of a fool a little bit because it's not. I mean, it's like trying to get away with something, but you can't get away with it, you know.
Yeah.
So, I mean, left to bad behavior, which I would probably could succeed at, but this helps me think and say this is silly to do this, you know. Yeah, no, I think it's a great tool for people. Just amazing.
So I think some things you learn on your own, even without even working with the doctor, right? So some things you can have a patient or someone wear a continuous glucose monitor, and even before they come back and see me, they say, Doc, I already realized bagels are terrible, or cereal is terrible, or whatever it is. But then there's some things where it helps when the doctor kind of points it out. Um, do you talk about numbers and targets and goals and time?
Not yeah. I mean, not as much. I mean, my weight we did, and then eventually, I mean, I used to weigh in the 190s, and then that's just to be dead honest with Ozempic, I've been literally she put me on it really early, like let's say 5 years ago, or 3 or 4 years ago, and that brought me down to like 165, and was unconscious. I just would eat less, and it's kept me there. Even though I'm not sure I eat any better particularly, but that it does monitor that, and so my weight's good, and I'm enough with my age, almost 80, to have a little bulk left in case I get sick.
Yeah.
Um, and and then my diabetes. I mean, it's like she gets, she'll get upset with me because I don't do as well as I probably should, only because I'm not disciplined as I think I should be. And obviously, if you're in more dire straits than me, you better be. Um,
Yeah.
you better really watch it. But the monitor makes you so aware of everything. You know?
And it's very fast. It tells you right away, right? Like
Right, immediately. Yeah.
even if you're wearing this every once in a while or not continuously, say you would change your medicine, like you add the Ozempic, you can see the impact of the Ozempic right away.
Right away. Yeah, no, it's sort of amazing, and particularly as they become more sophisticated, the devices. Literally, I could eat a cookie and the thing will register within probably 5 minutes.
Uh-huh.
Once it gets into your bloodstream.
Are there any kind of frustrations or challenges that you've had when you're trying to wear it? Have you ever had?
Well, no, I just think that the thing's just too honest. You know what I'm saying? So I'm not sure you want that. You keep thinking, wow, the alarm didn't go off, so I must have somehow escaped, if
Yeah.
you're a thinking person. But no, I think it then, it just says if I'm looking at patterns where I'm eating too much of something I shouldn't be eating, it makes you. That's one of the reasons every so often she puts it back on me to see
Yeah.
what I'm doing, just patterns of eating, and why am I going up at lunch or something. I'm saying, what am I eating? And then that makes you think about, well, what are you eating for lunch, or what are you eating for another meal, and
Yeah.
are you snacking too much in between, or whatever that is. Yeah, I think it's an incredible help for me,
Yeah.
and obviously, and somebody who has bigger problems with it, I think the monitors would be a godsend. I know plenty of people have them. Many people are like way overweight, and how it's saved their lives, no question about
And so, any of the concerns that somebody might have about wearing one, um, do you think that a lot of those are maybe overblown about like having something on you, or
it. Well, yeah, I mean, I'm saying I'm very aware of what's. I think I use the excuse of writing. I don't want anything to interrupt my sort of, in quote, creative flow, but and I was always worried that this is going to feel like something present and make me at least subconsciously think of it. No, it never did. It's like it's you just completely get used to it, and
yeah.
as it's become more um, compact and more easy to put on and take off and all that. It's just it doesn't exist to you except for when you need to.
So we've seen over the years people go from taking them or wearing them who have multiple daily injections of insulin to insulin maybe once a day to even not being on insulin and or being on oral medications or weekly injections. Um, and we find that every time we look at that, there's still benefit even in people on sort of less intensive therapies. Is is that
Yeah,
your
I mean, I
experience?
think this. I think in thinking about this, probably, and I'm thinking about what Dr. Peters would say to me. I think this probably kept me off of having insulin. Insulin so my I was able to get my A1C down where I didn't have to utilize insulin to regulate things.
Yeah, that's a really good line of thinking where it's almost like preventative. So
Yes,
instead
yes.
of waiting till you're on insulin to wear a continuous glucose monitor, by wearing it earlier, you can end up not on insulin in the first place, which is really what your goal is.
Yes, exactly, and that was a byproduct of it, according to Dr. Peters. That it kept me off of insulin. So I was able to get it down enough by being aware and modulating at least enough of my behavior. Probably not. I wish I could go under 7. That would be nicer. And
Mhm.
I mean, I just I'm like anybody else. You kind of get lazy, or you want to be a little hedonistic about things, and you shouldn't, obviously, when it's threatening you.
So some people say, oh, it's too much information. They give you all of these numbers like your time in range, your time above range, below range. How do you feel on that? Do you feel like intimidated by the amount of information, or do you feel more sort of empowered by having that
No,
information?
I mean, I think first of all, I only look at the information that I guess interests me. So that would be, what were 218 or 145,
Mhm.
for that, um, and then it's interesting to see how high you go during the day, where you then got to stop that, and then how low you could go at night and all that. But on this, I think it's tremendously preventative.
So
Um,
it doesn't sound like you've had a lot of low blood sugar experience.
no, I haven't. I haven't. No, not really. No, I don't. I don't.
I think that's something where maybe a lot of people have that experience where it helps you realize that you're going low in certain situations, or even prevent you from going low, which I think is
Yeah, I can
useful.
imagine that. No, mine has always been going too high. You know,
Yeah.
I think my baseline is probably a little too high to begin with. So yeah, no, I don't think I've had any. Maybe once where I was in a situation where I couldn't get to juice or food or something.
I don't know if all throughout all the years you had diabetes, if your doctor ever said, "Bring me your meter or your log books," and you didn't do it. But as a clinician, I find it wonderful that I never have to ask my patients for their log books or their
Yeah,
meter.
I haven't done any logbooks, to be honest with you, but yeah, but she's always had my meter. And
But
now
it,
and now with cell phones, she can see it right on the phone, in her records.
Yeah. What I find is that I tell patients it's good for you and it's good for me. I can do
Yeah,
my job better being able to see all of your readings all the time.
yeah,
And, I know what your pattern is. I know better what medicine, I can personalize your medicine so I know what to put you on next, or what sort of mealtime discussion to have. Is it breakfast where you're spiking? Is it dinner where you're spiking? Is it overnight? And that really allows me to pick the right medicine for the right person, which I
yeah. And I
think.
think it's also good for a patient, because if you have a good relationship, the way I do with my doctor, that you don't want to embarrass yourself. So when she calls me and says, "What are you doing?" What I'm saying, and
Yeah,
I go, "Well, I sort of went off the wag, whatever." And she'll say, "Well, let's figure out how to monitor that and get it right."
I was just having that discussion today with a patient. The continuous glucose monitors can show me what was their average for the last week, 2 weeks, month,
Right,
90
sure.
days. The last week before the visit is always much, much better than the
Yeah, of
rest of the.
course, that's funny. Yeah,
So that
that makes
goes
sense.
exactly with what you're saying there.
Yeah, yeah.
Is there anything when you've been wearing this that you had questions about? It sounds like obviously you have a good relationship with your doctor, um, but is there any way that you think that a doctor, maybe somebody else and somebody else's doctor, could do a better job of sort of educating them about the information that they're going to get?
I would just, I mean, I would just suggest that if those people who are unfamiliar with kind of science being part of their daily life, that they might want to be just educated in how it is not obtrusive and how it is, as I say, dead honest, and you will get some things you may not want to know, but it's going to help you in the long run. And it's just not, it makes things, I think, a little less frightening. I think that way.
Yeah. My experience a lot of times has been, I think this wearing the monitor is, as I've said, sort of a win-win. The patient doesn't have to do finger sticks; they can see their readings all the time. The clinician gets to see, what the pattern is, how to make adjustments, and things like that. I find it hard. Maybe you can help me. I find it hard to find a patient that wouldn't benefit from wearing a continuous glucose
I
monitor.
would only think somebody who doesn't want to benefit from it, who just would rather hide, whatever they're doing, because it has to benefit if you're gonna. But then you have to be willing to change some things, obviously.
Yeah.
I think if you're really interested in your health, yeah, I'm sure there are people who don't want to, they always want to be a rebel and this and that, but or they just have such an addictive quality about their eating and everything that it's another problem.
Yeah, and like you said, you've seen these generations evolve, and I think all the barriers that we used to have to using this technology, whether it was cost or convenience or sort of wearability, size, all those things are just, I feel like, going away, such that, again, these are so easily accessible that I think pretty much everyone should do it. My idea is kind of that it should be a part of sort of your annual wellness. Like you mentioned, all these things that track your fitness. Maybe it should be something like you turn 40, you start wearing a monitor for 2 weeks, and then if everything looks good, do it again when you're 45 or something like that.
Well,
Instead of
that would be great. Or you could do wear it. I mean, it's out of the 12 months out of the year, we could wear one for half a month and then skip a month. I guess. I mean, that
Sure.
would be up to the doctor and them.
And then ultimately, if you're diagnosed with diabetes, then it's going to be something that you're going to wear consistently, as we've said, to monitor your
Yeah,
medications and your
and I
diet.
think it would probably you have to tell me, but I'm sure it benefit people who are feeling like they're pre-diabetic in some way.
Yeah,
I think, yeah.
and like you said, prevention.
Yeah,
Yeah,
prevention. I think that's the best part about it. In that, or let's say preventing further debilitating diabetes.
that's right.
That it's just such a great. I think it's such a great tool.
Have you exercised at all wearing this? I'm just curious about that because I
Yeah,
know.
yeah. I mean, I don't do much heavy duty exercise, but you certainly could, and that I swum with it and everything else. I've never.
I'm just curious if you saw any change in your blood sugars exercising.
Um, I'm not. I'm not sure I do high enough impact exercise, just to be honest. I mean, I do what I need to do to, I mean, I need more exercise, I'm sure. But I do some, and that, I mean, I think for that period of time, it's obviously great,
Yeah,
Um, uh, I mean, that's the only time maybe I've had some instances of lower blood sugar when I've been exercising more than I normally do. But that
yeah.
just has to do with my particular biology.
Well, that's a good point that I was trying to see if you had noticed that. You can definitely pick up on the drop in your blood sugars with physical activity. Whether you call it exercise or just sort of, vacuuming the house or whatever it
No,
is,
right. You're right. You're right.
you're
Yeah.
burning a lot of glucose in those situations, and you're going to see a drop in your blood sugars.
Yeah.
So,
Well, anyway, I haven't seen anything really precipitous, so but I'm sure it would show me that, which is great to know. If you're
yeah.
about to get in trouble.
Yeah, in full disclosure, I have type 1 diabetes. I've had since I
Oh
was
wow.
a kid, and I've been on insulin. And to me, a continuous glucose monitor is the greatest invention,
Oh
that's
great.
changed my life in terms of these things. I also run marathons, and wearing these monitors is invaluable to prevent low blood sugars with exercise and things like this.
Interesting.
So my life is forever changed, having
Isn't
this
that
technology.
great?
So
Well,
I'm
yeah, that's what
very grateful for it.
Yeah, I
personally.
mean, my doctor has, I think, like literally 2,000 patients. She's one of the more well-known diabetes specialists in the world, endocrinologist, and I think she would tell you that probably 89 to 90 something percent benefit from the monitors. You know?
Absolutely. Well, I think that's probably all the time we have. So
Okay,
thank you so much.
nice conversation. I appreciate it.
Yeah, absolutely. I learned a lot about your perspective and just the benefits that you've gotten. So
Yeah,
thank
no,
you
it's
so much.
been great. You kept me alive, probably.